CNA Patient Rights and Autonomy. Welcome to the quiz. Question 1. You're attending an in-service training session on body mechanics and safe patient handling. The instructor is demonstrating proper lifting and movement techniques to prevent back injuries and strain injuries among nursing staff. She is asking staff to identify the essential principles of proper body mechanics when lifting patients or moving heavy objects. Based on principles of proper body mechanics and ergonomics, which statement best describes proper body mechanics when lifting a patient? Option A. You should bend at the waist and use primarily your back muscles to lift, as this distributes the weight across your entire back. Option B. You should keep your feet close together, twist your torso to rotate your body, and lift with your arms extended away from your body. Option C. You should keep your back straight, bend at the knees, keep the load close to your body to reduce strain on your back, and use your leg muscles to generate the lifting force. Option D. You should lift with your arms while standing on one leg and trying to balance, as this strengthens your core muscles. The answer is C. Proper body mechanics involve using leg muscles, keeping back straight, and load close to body. Option C is correct. Options A, B, and D describe unsafe techniques that increase risk of injury. Question 2. You are making rounds with your supervising nurse when you realize that you made an error in patient care. Earlier in your shift, you accidentally spilled a full glass of water on a patient's bed while assisting them with hygiene, and instead of reporting it immediately, you changed the wet linens and did not tell anyone about the incident. You are now feeling anxious and guilty about the error. Your nurse is explaining to staff the proper procedure for handling mistakes. When you make a mistake or error in patient care, what should you do? Option A. Keep the error to yourself and try to fix it without telling anyone, hoping that no one will ever discover that an error occurred. Option B. Tell another nursing assistant about the mistake, but ask them not to report it to the supervisor or nurse. Option C. Immediately report the error to the nurse, explain what happened, and work together to determine if the patient was harmed and what follow-up care might be needed. Option D. Only report the error if you believe it caused the patient actual harm or injury. Otherwise, you can document it in the chart without telling anyone. The answer is C. All errors, even those without apparent harm, must be reported immediately. Option C is correct. Option A is unethical and can lead to patient harm. Option B is gossiping and does not resolve the issue. Option D is wrong. Errors should be reported regardless of perceived harm. Question 3. You are reviewing infection control precautions in your facility's training materials and learning about different types of transmission-based precautions used for different infectious diseases. You are studying the different categories of precautions, including standard precautions, contact precautions, droplet precautions, and airborne precautions. You are trying to understand which types of patients require contact precautions specifically. Which type of patient would require you to use contact precautions in addition to standard precautions? Option A. A patient with pneumonia who has respiratory symptoms and is coughing frequently. Option B. A patient with a draining infected wound, diarrhea from Clostridioides difficile infection, or other conditions where infectious agents are present in body fluids or wound drainage. Option C. A patient with flu symptoms who is sneezing and coughing but has no open wounds. Option D. A patient with a fever of unknown origin who has not yet been diagnosed with a specific infection. The answer is B. Contact precautions are used for patients with infections spread by direct contact, such as infected wounds, C. diff, MRSA in wounds, etc. Option B is correct. Option A and C describe droplet precautions. Option D is not specific. Question 4. You are reviewing the procedures for hand hygiene throughout the patient care day and understanding when hand hygiene should be performed. Your facility emphasizes the importance of frequent hand hygiene in preventing healthcare-associated infections. Based on current infection control guidelines and best practices for preventing transmission of infectious agents, when should hand hygiene be performed during patient care? Option A. Hand hygiene should only be performed at the very beginning of your shift when you first arrive at work. Option B, you should only wash your hands when eating meals and after using the restroom. This is sufficient for patient care. Option C, hand hygiene should be performed before and after each patient contact, after contact with body fluids or contaminated materials, and whenever your hands are visibly soiled. Option D, hand hygiene is only necessary once per day. If you wash your hands at the beginning of your shift, you do not need to wash them again. The answer is C. Hand hygiene must be performed frequently, before/after each patient, after contact with contaminants, and when visibly soiled. Option C is correct. Options A, B, and D are incorrect and unsafe. Question 5. You are caring for Mr. Joseph Williams, a 75-year-old male patient who is hospitalized and confused. He has poor hearing and does not wear hearing aids, and he often looks confused or frustrated when people speak to him. You want to communicate with him respectfully and in a way that demonstrates that you value his dignity as a person. Based on best practices for showing respect to patients and maintaining their dignity during interactions, how should you appropriately address this patient during your interactions with him? Option A, use his first name informally regardless of his age, as this will make him feel less formal and more comfortable in the hospital setting. Option B, address him formally by his title and last name, such as Mr. Williams, unless he specifically asks you to use a different form of address. Option C, use nicknames to communicate affection and to make him feel like part of the healthcare team family. Option D, refer to him by his room number or bed number for efficiency and to avoid confusion with other patients who might have similar names. The answer is B. Always address patients respectfully using their preferred title and last name unless they request otherwise. Option B is correct. Option A may be perceived as disrespectful. Option C, nicknames are inappropriate unless the patient has indicated a preference. Option D, using room numbers dehumanizes the patient. Question 6. You are providing care to Mrs. Margaret Johnson, an 82-year-old female patient who is hard of hearing and has significant hearing loss even with her hearing aids in place. You need to communicate important information to her about her care. You want to communicate effectively and ensure that she understands what you are saying. Based on best practices for communicating with hearing-impaired patients and ensuring that important information is understood, which action best demonstrates effective communication with a hearing-impaired patient? Option A, shout very loudly at the patient to increase the volume, as this will help her hear you better even if it seems uncomfortable. Option B, face the patient directly so she can see your lips. Speak slowly and clearly, use visual aids or written information when possible, and confirm that she has understood your message. Option C, avoid talking to the patient altogether, as she will not understand anyway, and communicate only through written notes. Option D, write everything down in very small print regardless of her vision, as this is the best way to ensure hearing-impaired patients understand. The answer is B. Effective communication with hearing-impaired patients includes facing them, speaking clearly, using visual aids, and verifying understanding. Option B is correct. Option A, shouting distorts speech and is disrespectful. Option C, avoiding communication is neglectful. Option D, small print may not be readable. Consider vision also. Great job. Don't forget to subscribe. Bye.